Welcome to my YouTube channel. Today we are going to talk about antenatal corticosteroids. Kindly make sure you subscribe. It will cost you absolutely nothing. Antenatal corticosteroid. This is administration of corticosteroid during the antenatal period, and it's given to all fetuses between 24 and 34 weeks of gestation and who are at a risk of preterm delivery. The decision whether to give this corticosteroid should not be altered by race, gender, or availability of surfactant replacement therapy. The optimal benefits after giving now this corticosteroid, the optimal benefits it begins 24 hours after initiation. And then this is the most important point actually I think in this slide. It's the reason why or the role of antenatal corticosteroids is to reduce the incidence and severity of RDS, IVH, and NEC, but mostly RDS. RDS is respiratory distress syndrome, IVH is intraventricular hemorrhage, and NEC is necrotizing enterocolitis. Dexamethasone and betamethasone are the drugs which are used in terms. These are the corticosteroids which we use to give infants during the antenatal period. So this betamethasone or dexamethasone, these steroids are preferred over other steroids because they are less extensively metabolized by the placental enzymes, that is 11 beta hydroxysteroid dehydrogenase type 2. So that's why we prefer betamethasone or dexamethasone. However, between dexamethasone and betamethasone is often preferred due to its longer half-life and potential fewer side effects. So in terms of doses, which we said betamethasone is the most preferred one because it has a longer half-life and less side effects. So the typical regimen is 2 doses of 12 mg, which are administered IM 12 hours apart, and then total you'll have 24 mg. And then dexamethasone, the total dose is also 24 mg, and the regimen usually consists of 4 doses of 6 milligrams of dexamethasone given IM every 12 hours, and if you multiply 4 doses of 6 mg, 4 times 6 is equals to 24. So what are the maternal effects? Corticosteroids, if you know normal physiology, if you take corticosteroids, they lead to elevated blood glucose. So that will be one of the side effects. So you can have transient hypoglycemia. This is the steroid effects usually begin approximately 12 hours after the first dose and usually remain or it may last for 5 days. So it's very important to screen these mothers of gestational diabetes if indicated, and should be performed either before you give the antenatal corticosteroid or at least 5 days after the first dose. And then the total leukocyte count usually increases. The total leukocyte count usually increases by approximately 30% within the 24 hours after initiation of the antenatal corticosteroids, and the lymphocyte count usually decreases significantly. So what happens? The total leukocyte increases and the lymphocyte decreases. These changes return to the baseline within 3 days, but may complicate the diagnosis of an infection, because if already we have total leukocyte count which has increased, and then you do a CBC and then it comes, obviously your mind will tell you that this is an infection. So if it does not go back to normal by 3 days, then you should look for other causes of infection. So this is just a summary of the antenatal corticosteroids, and we see that we have 2 of them, betamethasone and dexamethasone. And the betamethasone is the most preferred because we said it has a longer half-life. What else did you say it has? It has a fewer side effects. How do we give it? We give 2 mg. How many doses? 2 doses. How many hours apart? 24 hours apart. What of dexamethasone? Dexamethasone, we said you give 4 doses. How much? 6 mg. How many hours apart? 12 hours apart. So the mechanism of action of the antenatal corticosteroids, they usually stimulate the development of type 1 and type 2 pneumocytes, and therefore this will stimulate the synthesis and the release of surfactant, and this induces the airway epithelium challenge gene expression. Therefore, you have less incident and severity of respiratory distress syndrome. So this decreases the incidence of respiratory distress, and decreases the need for respiratory support and may decrease the duration of NICU and special care. In addition to respiratory distress syndrome, what else did we say which has to be in your fingertips? We said neck, and we also said IVH. Don't forget those two. In terms of the side effects to the newborn, you can have hypoglycemia. This is usually occurs in late preterm infants. And in terms of long term, you may predispose the patient to having increased risk of mental, behavioral, and neurocognitive disorders.